Hi, everyone. Welcome. Thank you for joining us at Cochrane for our COVID 19 series of emergency justice. This is our third one out of our series of four of decarceration. I wanted to say thank you for joining us again. My name is Tammy Nguyen. I go by she or her, and I am the movement coordinator at Cochrane. I wanted to do some protocol today. We are doing closed caption, and we do have interpreting from English to Spanish, and you can find that on the bottom of your toolbar if you um, want to or need to use that. Um, you can find that on the bottom, and if you need assistance, please let us know in your chat box. And during this time, you are muted. So if you need to communicate with us, please let us know through the chat box. And I want to go over the agenda for this evening. We are having speakers, and we have Maru, JM, and Will with us this evening. And during the time that they are speaking, we are doing Q&A, and you can put your Q&A in the chat box, and we will do Q&A after they speak. And also, it wouldn't be Cochrane if we didn't take action. And this is our third event. So if you've been to the others, you know we did actions at the other ones too. So we'll be taking an action at the end of our speakers after the Q&A. So without further ado, I would like to welcome JM to join with us. I think you're muted, JM. Okay.
I'm unmuted now. Thank you, everyone. Thank you, God Green, for hosting this series. Thank you for the other speakers for coming through too, and interpreters. So I'll introduce myself. My name is JM. I go by she, her, they, them pronouns, and I'm part of a collective called COVID-19 Mutual Aid. And we are a collective of community members that came together when COVID-19 first started appearing in the Seattle area. And we have various work groups. We do horizontal mutual aid work. And that involves like grocery deliveries, fundraising for our survival fund, mask deliveries. We collaborate with Gathering Roots and a lot of other community organizations that also do similar work. And then we also do worker solidarity stuff, bringing together workers who are, who have to choose between their health and well-being versus their economic livelihood. And we're saying that's a false choice. That's always been a false choice, but especially now in the moment of pandemic, we want to support workers being able to meet their needs and also resisting on their workplaces if they have to. And then we have another work group called Abolitionist Public Health, and it's bringing together folks who have been doing abolitionist work in the region for a long time. We have partners in the Black Prisoner Caucus, inside and outside, the API-CAG, the Asian Pacific Islander Cultural Awareness Group, the NGC, Nuestro Grupo Cultural. Those are the folks who have been organizing in the prisons for a long time. And so for those of us who came together as abolitionists public health, we draw really heavily from, I want to give a definition of abolition from Ruthie Gilmore, who has been really influential among our circles. She says abolition is about abolishing the conditions under which prisons become the solutions to problems. It is not only abolishing the buildings themselves, but the conditions and the root causes of why prisons are used as solutions in our communities. And we see that as a characteristic of austerity and capitalism, that the state, surveillance, and prisons become strategies that are used to control the population, to discipline the labor force. And we see that in a lot of countries as well, even though the US, being the advanced capitalist country that we are, has the highest prison population. So our collective comes around values of collective freedom. We're doing work out of solidarity, not charity. And we see, the abolition work, the worker solidarity stuff, the horizontal mutual aid as all part of this landscape of supporting autonomy, valuing human life, where we say no one is disposable. So we have been organizing around, against DOC since COVID broke out. I mean, we've been doing that before, but in this moment, we came together as this formation, and we have certain demands. I want to share the demands. You can go to the next slide, Shan. Yeah, so we want to highlight that, it's predominantly poor, Black, brown, Indigenous, people of color, poor white folks who are behind prison walls right now. And there has been a lot of attention drawn to what Governor Inslee has said. He's been releasing, actually, he's talked about releasing 1,100 people. And a lot of those folks are characterized as quote unquote nonviolent offenders. And their sentences were supposed to end really shortly. So we're saying that that's not enough. And we also want to highlight that Governor Inslee made that declaration only after folks in Monroe, which is one of the prisons, organized and protested because people are so desperate to live and have so much anxiety around the conditions inside. And family members of the Monroe folks gathered at Monroe and protested as well. And that brought a lot of attention to the issue itself. We tell Governor Inslee that 950 releases or 1,100, which is the new number right now, is not enough, in part because they're actually not even releasing that number of people. So far, they've only released 680, and there's a lot of challenges for folks and a lot of barriers folks are facing for their release. One of the things that we have identified, folks have been telling us, is when they don't have confirmed release addresses, then they're not being let out, right? And we know it's a class issue for why folks may not have release addresses that are approved by the Department of Corrections. You can go to the next slide. So our criteria, we've been demanding for release 2 broad categories. To let them go, we want, there's overcrowding within the Department of Corrections. There's currently 17,000 people in 12 facilities, and that's way too many. There's no way they can do social distancing in these settings. And we're also calling for safer conditions. And we think that the governor's criteria of releasing only nonviolent folks is really limited because COVID-19 doesn't discriminate based on sentencing charges, right? And we demand that people who are medically vulnerable, especially those over the age of 50, people who are about to be released with 18 months or less, people who have served over 15 years or who were sentenced as juveniles. We know that statistically, folks who have these sentencing charges, the recidivism rate is really low after they are released. So, and especially pregnant women, postpartum folks, there are kids in the women's prison. A lot of people don't know that. And we're demanding that these people all should be considered vulnerable populations and released, and that these sentencing charges of violent versus nonviolent is really racially charged, because knowing how the courts work, folks of color have disproportionately, more severe sentences for the same offenses that are committed compared to white folks. You can go to the next slide. So yeah, we're hearing a lot from folks inside that, DOC, it's not honoring, is not able to implement, just structurally, they are not able to implement the conditions that we need, like the 6 feet rule, sanitation. So we still are hearing about people being double bunked, triple bunked, and that, and that's not safe for our people. And one huge thing that we're hearing is that people are not reporting their symptoms, even though they're sick, because what DOC does is throw people into the hole, like into isolation, right? And being sick is, you're treated with a punitive response, right? And like further stigmatization. And for us out here, we know there's a very basic public health principle, is there should be no stigmatization against people who are showing symptoms, because that's one way to really discourage people from taking safe measures and reporting their illnesses. So that's something that we're really demanding has to be changed, that we shouldn't have a punitive response to people who are expressing symptoms. And the other thing that is huge right now is there's not enough testing. So if you look at the DOC website, it says they tested 350 people as of today, and there's 17,000 folks who are currently incarcerated. And we know from around the country that prisons are hotbeds. There's outbreaks of COVID-19 in prison facilities. And we know from Ohio that 80% of the prison at Marion County, the folks inside have been positive. And so DOC really needs to test people. And there's the same thing that's happening with us out here, that the lack of testing is used to mask the number of positives and used to mask the level in which, COVID has spread within the population. Well, also, I guess I want to give a shout out to some of the organizing we're doing right now. On May Day, we had this beautiful May Day caravan, peaceful, nonviolent, everything was very celebratory. And one of the stops we went to was the Reynolds work release site. And people may not know, but there are workers out here, who are working under the surveillance and supervision of the Department of Corrections. And a lot of they don't have a lot of worker rights because so much of their ability to stay in work release is, compliance with DOC and compliance with the employers. And so when we talk about right to collective bargaining, right to organizing, a lot of incarcerated workers don't have that right. And so we had we had a demonstration outside the Reynolds work release downtown, because we have been hearing from family members and folks inside that there's actually a lot of positive cases of COVID in there, and the administration was not taking measures to address that. Folks were being quarantined, people with symptoms were still allowed to go to work, and there's a level of coercion when they're at work release. And so there was a demonstration outside. It was really celebratory, and we know after that some folks were retaliated against, and some folks were sent back to the prison from work release. And we call that out because folks inside shouldn't have to pay for the organizing that their family members conduct outside. This is part of just this racist surveillance, disciplining measure to try and keep this on the DL, try to keep these issues around COVID behind closed doors. And we have some call to actions on our Instagram page and our Facebook, and really hoping people can pay attention and call DOC demanding the release of some of the folks who were targeted. Another major demand we have that's related to that, I think Maru will speak to as well, is, DOC transfers people to ICE custody after they serve their time in DOC. And this is what happens for a lot of folks with ICE detainers or folks who are immigrants. And we're pushing DOC to say, DOC itself is a dangerous place. ICE also is a dangerous place, and folks should be released to the streets, to their families, rather than being transferred from one dangerous facility to another. I guess that's what I'll say for now. And yeah, thank you very much for coming through. Yeah.
Thank you, JM. And I would like to welcome Will next.
Mute.
Will,
Okay, there we go. I was able to unmute. All right, thank you. I appreciate the opportunity to be on this wonderful platform around a very serious issue that is impacting a lot of us. Everyone lives at this particular moment is being impacted, and one of the things we cannot do is overlook the impact that it's having on some of our most marginalized and most unprotected populations, which is those who are on the inside. And just to give a little purview a little bit, my name is Will Jimerson. I'm also a spokesperson for the BPC, which is a Black Prisoners Caucus, or Black Building Positive Communities, as well as the Executive Director for United Better Thinking, and also as well the Community Facilitator, Project Program Manager for Zero Detention. So all of those are in alignment to get us to a population of, I would say, to zero, but more so importantly, to get us off of the addiction of mass incarceration. But just to kind of bring it back to the issue that's at hand, we know worldwide there's over 200,000 confirmed deaths. In America, US right now is the epicenter of pandemic of COVID-19, with there being over 1.2 million confirmed cases, and we have over 73,000 confirmed deaths. And we here in Washington State, the last numbers we had were over 15,000 confirmed cases and 187 confirmed deaths. And so where did that place us at in terms of what's going on the inside of the P-now institutions, inside of the city jails, the county jails, also the Department of Correction facilities, is that when you look at the recent report that was laid out by New York's Times, even yesterday, looking at Truesdale, Turner Correctional Center in Hartsfield, Tennessee, they have about 11,000 residents, and their cases of COVID-19 has skyrocketed to 1,344 from 27. And the reality is the prison appears to be responsible for a huge spike in these cases. It's no different than what's going on here in the state of Washington. A lot of people are trying to turn a blind eye on this growing elephant that we will not be able to control if we do not do some things sooner than later. It's going to consume us in a way that is going to impact the rest of society. And some people will have the question of, why be overly concerned with the population of individuals who are serving time? We are out here already dealing with issues. We don't want anybody else who might potentially add to those issues. When we look at the social determinants of health, the reality is when we started to have confirmed cases and looked at the social impacts, it was inside of a confined residential areas, right? It was inside of senior citizen homes. It was inside of, homes. I think it was in Kirkland. I can't remember the name of the senior housing, but there was an outbreak and there was an outspread. And the reality is those populations are no different than any other confined populations. And if we do not do anything about that, that is going to have a major impact and a major increase even on us here in society. So those are some of the social determinants. And also some of the other social determinants connected to this process is many of those individuals who are incarcerated, they're also making a PPE, they're making a personal protection equipment, they're making the surgical gowns. So if these individuals are not given the proper care, the proper treatment to be able to facilitate, access to be able to address this issue, then what happens is if they even sneeze, because there's growing reasons of how this disease is spreading. There's a lot of speculation. There's only testing that we have that allows us to know what we know right now. We don't, from one day to the next, there's new information in terms of how this can be spread. And even there's predictions right now that if we do not do anything to curb these things, by August 4th, there's scientists who are actually predicting an additional 100,000 deaths here in the United States of America. And if we do not do anything, these things can spread. And like I was talking about the personal protection equipment with the those who are incarcerated, making this environment, making these material, if they're not even being tested and they're not being protected, it potentially can spread on this garment, on these materials. And then the doctor takes it into the surgical room where there's already somebody who has a compromised situation. And so these are things that we definitely want to think about. JM did a wonderful job just kind of laying out some of the demands, laying out some of the reasons why, but just to bring it in the humanity into this space. These are people's brothers, sisters, uncles, cousins, nieces, nephews, individuals who over 90% of individuals who are incarcerated will eventually return here in the state of Washington, will return to society. So they're coming back home anyhow. And the reality, we're not just saying let anybody out because we're in this pandemic. We're saying this is going to be a safety net, not only for them, but also for us in society. Because if it's not contained there, it's not going to be contained anywhere else. And just to give you guys like a real personal aspect, just yesterday I had one of my young men that I work with, and he had gave me a call and he was like, just keep my father in your prayer, because prior to that, we've been working on trying to get his dad home because he has a compromised immune system. He has asthma. He's in federal custody at this particular moment for a nonviolent offense, for marijuana, actually. And so we've been working on it, and they gave him 13 years, right? And he's a family of 5. He has a family of 5, and was very present in his children's lives. And so now this man is in his 40s, just recently was sentenced to 13 years, and now serving time for nonviolent offense for marijuana drug charges. And they sent him down to Kansas City. He's from here, from the state of Washington. And so he calls me and he said, "Hey, um, can you keep my father in your prayers?" And I'm like, "Why? What's going on? We're trying to work on getting him out." He's like, "Yeah, they said he's in a hospital, but they won't give us any no updates to his conditions." And I'm like, "What's going on?" And so we finally get an update. They said, "Oh, he's doing good. He's doing well. He actually is one of the best out of the people that's responding, but he has tested positive for COVID-19." Because at first they wouldn't give them no information, and it took them, the family had to beat down the doors to finally find out why the father was being admitted to the hospital. And so just today we found out that his father's on a ventilator system, and he's unconscious and he's unresponsive, you know. And this young man is he don't know what to do. He doesn't know what to think. His mother is very heartbroken at this moment. She's talking about just getting on an airplane and going down there, but to do what? They don't know where he's at. They don't know what hospital he's in. And even if they were to find out that information, they're not going to allow the family to have access to go inside the hospital room for a variety of different procedural reasons. And so these are the things, just to kind of bring the humanity back into the space, that we have somebody, God forbid, but is potentially on their deathbed if we don't have a turnaround in the situation. And these things are happening all over. And this is a family that's right here from this state of Washington, from the city of Seattle, that's being impacted by COVID-19, that should not have to be in these conditions. And had that individual, the man that we've been fighting for to get out, prior to all of this, he would have been out without even contracting COVID-19. But now it looks like he already has contracted it before we can even get any ruling on any possibility of him coming home, because he already had an identifiable a compromised immune system with asthma, and as well as he had a kidney infection that he had surgery for a few years ago. So before we can even get to that point, here we are now with him being unresponsive on a ventilator machine. So there's more that we have to definitely do. Thank you.
Thank you very much, Will, for that insight and that story, for sharing that. And you know, um, next I wanted to bring on Maru to share her take for us.
Hi, um, thank you for the invitation. My name is Maru Mora-Villalpando, and I have some slides, so I think we're going to show that. I'm part of La Resistencia. La Resistencia is a totally grassroots volunteer group that came together back in 2014 in response to, so far, the largest hunger strike ever in a detention center in March of 2014, where 1,200 people decided to stop eating to call the attention of everyone outside of the terrible conditions that they have lived. And that everybody that has gone through the Northwest Detention Center, whatever name goes by, who cares? A cage is a cage, even if you call it differently. We will always call it NWDC, located in Tacoma. And so NWDC opened in 2004, 16 years now of existence. Because of the creation of ICE, Immigration Customs Enforcement, back in 2003. Remember the Patriot Act, then the creation of Department of Homeland Security. Within that, Immigration Enforcement, which now we call ICE. I'm glad I'm the last speaker of the three, because I think both JM and Will were really good at laying the ground of what is the carceral system in the US and in Washington state. And for us, it's always important to explain that immigration detention is nothing but the extension of the prison system. It's another way of controlling our bodies. And this is very specific to immigrants. poor immigrants, and immigrants of color. I always give this example. I don't know if people here know of, I'm really bad with popular culture, so I'm gonna do my best. Justin Bieber. I know that guy because I think he had some DUIs and he's from Canada. But you never saw the news that he was put in deportation proceedings, right? Yet there was what, 21 Savage, right? I think that's the name of that rapper. He's from the UK, he's Black, and he was placed in deportation proceedings. So I think that's a good example of, you know, two famous pop icons, yet one is Black and one is white. So that's how really the immigration system operates. And so what we're looking at right now in the detention center is that people throughout the years, and they didn't start it in 2014. I just want to clarify that. It's not that they started in 2014 with hunger strikes, but what happened is that in 2014, there was a group willing to support in the outside the calling from the inside. So that's the difference. But since the day opened, we knew there were hunger strikes. We knew the people were organizing against this detention center. So by the time 2014 comes, the population is almost at a max, which is 1,575. And throughout the years, I can tell you, in these 6 years of support and organizing, we have seen 22 hunger strikes that we have supported. And every time people go hunger strike, from 2014 to 2019, you will hear anything from, you know, we have maggots in the food, we don't get medical care, we have unsanitary conditions, guards mistreat us, especially those that don't speak English. We've seen, for example, in instances of people from Cuba, when they have to be released because Cuba is not gonna take them back, they release first the light-skinned Cubans and last the black Cubans, right? So it's a very racialized system. And so what we're looking at is to precisely, if we know that prisons and jails are not a place where you can practice social distance, why would you even excuse NWDC from continue operating? As the first cases of COVID-19 started happening here in the detention, in Washington State, we knew NWDC would be the next spot, right, for COVID. And so we started, you know, sounding the alarm, and we start asking, especially the Tacoma Pierce County Public Health Department, what are they gonna do? And, you know, they just brush us off, as most local elected officials and the governor, they always just point the finger to the feds. And the feds, they point the finger to the fact that it's a contract between GEO, the corporation that owns the place, and ICE. And so what we were trying to do at the beginning is to say that it is impossible that what we're being asked to do in the outside, people inside these cages can do. It's just not possible. And we have experts, right, saying that it's just not feasible. We have public expert, health experts sending letters to the governor. You have them, you know, in TV. We have projections that said that between 72 and 100% of people in cages will acquire COVID-19, will be positive of COVID-19. So similar conditions that what we see in the prison system obviously will happen too in detention centers. So just this year, well, let me go back. 2019, we saw about 12 to 13 hunger strikes throughout the nation. Just this year alone, we have 22 hunger strikes already. That means thousands of people have gone on hunger strike due to COVID-19 because they know they're gonna die in there. Because if detention centers were already known for horrible, horrible conditions, now you add to that COVID-19, it's a death sentence. And so as the governor started saying, well, you know, we need to keep social distancing, stay home, we said, you know, what about NWDC? Remember, NWDC is a business. And even according to the Attorney General, it's a business because the AG filed a lawsuit against them in 2017 for not paying a minimum wage to those that work in there because yes, people, you know, we get detained because we don't have a social security, but when you go and work there, nobody asks you for a social security number. So you work for $1 a day, if so. And so we're saying, how come you are applying these rules to everybody except NWDC? So we're asking people to report NWDC for not practicing social distance. If we go to the next slide, We also have seen how people inside have done everything and anything possible along with their families to tell us how things are inside. So because the first thing that happened in the detention center was that they stopped social visits, we couldn't and limited really the access for lawyers. We found ourselves in a very difficult position of how to document what's happening, because that's really our main role as collaborators of people in detention, because we believe that the fight is led by them. They're our leaders. We should just follow. We have to become very creative. How do we get these conditions documented and publicized? So we start getting pictures from relatives, doing video calls with them. And so this is a picture from April last month. This is during a video call, and you can see, this is I believe, April 17. And you can see no social distancing, no masks. People keep complaining about the guards. The guards are coming in and out. They don't have masks. They don't wear the gloves. They say, even if they give us masks to us, the guards are the ones coming in and out. So how are we, they're the ones that are gonna give us the virus. They need to be wearing the masks, not us. And we have a lot of pictures and videos and audio that we have in our social media pages, because that's what people want. They want you to know, to hear, to see, to watch what is going on inside. If we go to the next one. Again, the governor said non-essential businesses need to stop operating. And what about NWDC? It is a business. All the people that you saw in that picture, they're all working somehow. They're either cleaning the pot, or they're doing the laundry, painting the walls, working in the kitchen, you name it. So it is a business, and it's not essential. By the way, the governor signed in March a law, HB 2640, that precisely says NWDC is non-essential. It's a non-essential facility. So we want to remind the governor, one, it is a business, and two, it's a non-essential business. So report them, because you can report non-essential businesses still not following the rules, even though we're on phase 1 now of reopening. In the next slide, this is from April 15, and this is an action that was organized by people in detention. They told us about it. They said, we want you to come and take pictures. So when we went there, I think we got a little bit early. They were not being released to the yard. It took about 15 to 20 minutes of us waiting. We even had to pretend to leave so they would let them out. Later, we heard that where people were waiting to go to the yard, and they were waiting and waiting, they had to do an action. So they all started yelling together, yard, 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 until they finally were let go into the yard. And that's how we got the pictures. And probably you can see what they did. They spelled with their own body SOS. It's as clear as water, right? I mean, it's very, very clear. This is an emergency call. They're telling us this is a distress call. We in the outside have to do something. We know 5 days ago, ICE reported 522 people with the being positive throughout the nation. They didn't say exactly how many detention centers are positive of people detained. Now, that's out of 1,073 that were tested. And we know that in detention right now, we have more than 30,000 people detained. So 5 days ago, out of almost 31,000 people detained, only 1,073 were tested. Just today, we learned that one person has died in detention in Otay Mesa, New Mexico, because of COVID-19. Obviously, those numbers between 5 days ago and now have increased. We believe is nearly 1,000 people now tested positive. 2 guards already died in Louisiana because of COVID-19. We know that in NWDC, ICE has said that they have 100 tests, but they don't want to test anybody. ICE doesn't want to test anybody, or they have lied. They have told people, sure, come in to the medical unit. They put on a swab into their noses. They go into a room, come back and say 10 minutes after, it's negative. They don't have what is required to do a test there. So they lie to people. or they deny the care altogether because they don't want to say that people are sick. So they're not forced to to release people. So again, we have, actually, it's a small quantity of people if you compare to last year. Last year we had over 50,000 people. So knowing that we have over 30,000 people right now is a smaller population versus last year, yet it's not good enough. We need to have 0 people detained, of course. So we're asking you to be part of the Free Them All campaign. On May 14, we're gonna start a national week of action. We're gonna be announcing each of those weeks that we're gonna be working alongside many other organizations across the nation, from May all the way till July. I think for us, it's important to remind you, if lawsuits, if litigation worked, we wouldn't be doing this. But law doesn't equal justice. Law doesn't guarantee that we're gonna be free. And that's why we have to do our work. And a good example of this is there's been several lawsuits, and at least 2 of them that are forcing ICE to release people into detention centers. In one of them, hundreds of people should be released by now at Adelanto, which by the way is also on hunger strike. Yet ICE has not released anybody there. They don't want to release anybody. So we cannot wait for them to do it because they're not going to do it. Right? We have to force them to do the releases that we need them to do. And that means also stopping people from coming into the detention center, which means the collaboration with all the efforts in decarceration in the Department of Corrections. So we want to make sure that the governor also stops the transference from DOC into the detention center. So Inslee needs to take responsibility. This detention center is in Tacoma. These people are Washingtonians too. He cannot say that Washingtonians are his priority when he's forgetting about people in cages. So he cannot get to pick and choose who is a Washingtonian. And we have to remind him of that. And lastly, I just wanna mention that today we had somebody that was released. He was really happy. He was, I can not even describe to you how happy he was. He was detained for over a year. And he was saying, how is it that a system that is supposed to be there to protect people are harming people so badly? And they feel that they can do it and nobody's gonna care, because that's what happens inside. People get tortured, people get abused and oppressed, and the guards and ICE do it because they know they can do it. And they think they can get away with it. And it's up to us whether they can get away with it or not. So we have to remind ourselves, we are there for everybody, not just for a few. We're demanding absolutely everybody to be released. No questions asked, not picking and choosing, not putting some above the others. Everybody's a human being. And we should make sure that this is our chance to stop the massive expansion of the carceral system, both in the criminal system and in the immigration system. Thank you.
Thank you. Thank you to Maru and JM and to Will, to all of our speakers. Before we move into our Q&A for our speaker, I just wanted to make the link of why an organization like Cochrane cares about decarceration, because, you know, prison has socialization and environmentally toxic. It's unhealthy for our environments, and it's a system that, you know, military and enforcement is being responsible for our crisis, not the answer for our community. And in a crisis or anything like this should be, solutions should be coming from our community. And you have heard from our speakers that, you know, there's, our system is being corrupted in many ways. So, and even in a pandemic, it builds a lot of stress. And that's why an organization like Cochrane want to build space for this, to address it. And with this, after Q&A, We will be taking action, and I hope that each and every one of you will be staying to join God Green and our speakers to be taking action so that our governor will be hearing from us as whole tonight and today. So please stay in tune because Tanika will facilitate us through our Q&A.
Thank you, Tammy. Hello, everyone. I'm Tanika. And there was only one question in the chat box this evening. So I guess the presenters did a wonderful job of informing us and giving us great information. The question I have is for Maru. Were the 22 hunger strikes across U.S. for this year? Maru?
Yes, I was on mute. I need to wait for the host. Yes, so those are 22 hunger strikes just this year. And that doesn't mean it's all of them. Those are the ones that we know. So we, along with the Attention Watch Network, have created a support network for grassroots organizations across the nation that face, in their areas, hunger strikes in detention centers or county jails that have contracts with ICE. And so those are the ones that we have recorded. But again, there's many hunger strikes that happen that no one ever knows about. So that's a lot in comparison to just last year that we had about 13.
Okay. Well, I have another question now for Will. Will, what can we do to help the families and let's see, I'm sorry. What can we do to help the families and their loved ones incarcerated and dealing with COVID-19?
Yeah, so what could be done? Really, man, there's obviously I appreciate the fact that this platform is one of those answers or part of the solution. It's getting the message out there, share this information. I think there's going to be a link that follows up with this platform. I think the platform should be shared, but just to be directly get involved, you can hit me up at W Jimerson at United Better Thinking. Well, W Jimerson Jr. at UnitedBetterThinking.org, or you can hit me up at wijimerson at kingcounty.gov. And my number is 425-902-7755. So that way, if there's anything specific that you're looking for to get involved in around this particular issue, then we can make the best way to do that. There are needed resources, as JM had laid out. When there's individuals returning to society, there's needed and necessary resources for those returning. There's needed and necessary resources for those who are currently in there, and there's needed advocacy for specific populations that are compromised at this particular moment. And so, if you're willing to get involved and you want to lend, your sweat equity to the process, you can definitely give me a call, or you can hit me up at either email, and I'll return with specific tasks, that you can get involved in that we're already making some headway on. So hopefully that answers your question.
Okay, Will, can you give us your contact information again and slow down a little so we can capture it?
Yes, my contact information is W Jimerson Jr. at UnitedBetterThinking.org, or you can contact me at wijimerson at kingcounty.gov, and my phone number is 425-902-7755, and I'll place that information in the chat box as well.
Thank you, appreciate that.
Yes.
Okay, well, that sums up the questions that people have so far. Let's see. I have a question from Nicole Johnston. Let's see. Is it clear that justice means, hold on. Is it clear that justice means letting everyone free, avoiding, I don't know this word, dichotomies of violent, non-violent, etc.? I'm hoping to hear from all the speakers about their thoughts about what we can do to prepare for the return of masses of people. That's something I've wondered myself. Anyone can answer first.
Yeah. Will, you want to go first?
You want me to repeat it?
Yeah, please do. Please repeat it.
Okay.
My apologies.
There's a word in here that I don't know how to pronounce, to be honest. It's Dichotomies. So,
Dichotomies?
yeah, dichotomies. Thank you.
Yeah.
It is clear that justice means letting everyone free, avoiding, well, I can't say it now.
Dichotomies?
Dichotomies of violent and nonviolent, etc. I'm hoping to hear from all the speakers about their thoughts about what we can do to prepare for the return of masses of people.
Yeah, that's it's always a tough one, right? Because there's those subjective and there's also those objective aspects in terms of being analytical around what does justice look like, what is justice, is really bringing other folks' humanity into the space, tying your liberation to their liberation. Dr. King has said it more eloquently than I could probably put it when he said a threat to justice anywhere is a threat to justice everywhere. And so right now we are in an injustice system that is a threat to everyone's humanity. And so it's a threat to everyone's liberation. And one thing about being on a sharp edge of injustice, as Black and brown and yellow folks are in this particular country, we can feel it a lot more right away, right? When you're on the sharp edge of injustice. But those who are on the outside of the blades, they don't feel it as much because they might be getting nicked. But the reality is you're getting cut as well. And eventually, if our population it becomes extinct, then someone else has to end up on the other end of that blade. And so you will be next in line. So as Dr. King said, a threat to justice anywhere is a threat to justice everywhere. So it's not just having a blanket response of just saying everybody has to be set free, because what is truly freedom, right? Just coming into society does not mean that, all of your issues and all of your problems have now they have dissolved and they're no longer in existence. We still have issues and we still have problems that are a reflection of a lack of justice, even in society, So we're not just saying opening up the prison doors and open up, all these different isolation cells or chambers or death chambers at this particular moment is a form of justice, but it's a step in the right direction, to understand that we have to acknowledge that many of the rules that are very draconian, that have been fixated off of taking advantage of marginalized populations, has placed people in certain more, disenfranchised and crippling positions, and in the first place of why most folks are there, right? And just to speak on the fact that we have a young man whose father is on ventilation for marijuana charges, but we also have Uncle Ike who gets millions of dollars on 23rd and Union for selling marijuana, and he's not sitting in no prison cell. He's not faced with, his life coming to an end because of being exposed to COVID-19. This is unfair practice. This is an unjust system. And so we have to be very true of how we approach and we be responsive to all these different social determinants of health that are impacting majority of marginalized communities and communities of color. And so we have to be realistic of when we talk about what is justice, what does justice look like. Oftentimes the opposite of justice, which is injustice, impacts us harder, and COVID-19 is an extension of that. Thank you.
Thank you. JM, did you want to answer?
Yeah. Actually, Maru and I also have been having this conversation, and Will and I also have been with a collective of folks, and there's so much in this question. Thank you for asking that. I think I want to talk about one thing that popped up in my mind, which is really painful, is you know, as part of Inslee's commutation, he's talked about releasing 1,100 people. Realistically, he hasn't released all of them. But we have a family member who got in touch because she's immunocompromised, elder in her 70s, and has a lot of health conditions. And her son is in one of the facilities and was in quarantine. So he's been exposed because, I mean, not surprising, a lot of people have been exposed in DOC and are in quarantine right now. And his name is on the list. And she is immunocompromised. She's a vulnerable elder, should not be exposed to anyone who has been exposed to COVID. But she doesn't have the ability, resources to house him elsewhere for 2 weeks. So she says yes. And for her, the choice is between her health, her well-being, versus her son continuing to be incarcerated and quote unquote missing the boat on getting out. And that is just, it's painful, it's tragic that families have to make these choices just to get their loved ones back. And, you know, we've been discussing like what should we put out as like some demands for DOC around reentry. And one of the things we have is DOC needs to be responsible for quarantine housing. You know, right now they're using the whole as quarantine, as isolation for COVID-19, and that's completely inhumane. And they need to be giving out vouchers for quarantine housing in motels and hotels for 2 weeks at the very least as people are getting out, and not place that burden on families that are already struggling with their folks inside. It costs a lot of money to support someone who's incarcerated because families care about their loved ones, and they will pay all these exorbitant amounts of money for, you know, phone calls and emails just to stay connected. And to place that burden on families right now in this moment when everyone's struggling is just, it's cruel, you know? And I think the question of reentry, I mean, there's so many layers to that conversation. There's the material aspect, resources, folks need housing. Housing is used, the lack of housing is used as a way to, it creates barriers for people getting out. People are rejected from release because they don't have quote unquote confirmed addresses that are approved by DOC. So definitely housing is a resource. And then, you know, people need support, like families with loved ones inside are struggling, and people need financial support, people need education, job opportunities. That doesn't change from pre-COVID times. And then there's the layer of emotional, you know, support for folks coming out to support their transition. I think these are hard, you know, we can lay out the needs that folks have and what it means to return back to a beloved community. But the reality is this is a moment of austerity, you know, like mass incarceration is used as a solution for the problems that arise because our states have divested from caring for each other, have divested from social services, from education, childcare, and folks are returning back to a community that is, you know, facing all those challenges, right? And we know that that's racially disproportionate, like, you know, Black, Brown, POC families are, you know, wealth, income-wise, we aren't balling like the AMI in Seattle, right? And so that's, I think, something really hard is like, how do we imagine this long-term? And I think that's why a lot of us do the abolition work, because it's not just about this short-term getting people out, it's also about how do we create a world where prisons aren't the solutions, right? Where we can all thrive, where we do have the resources to support people who are struggling and not have to resort to the state or criminalization to address society's problems. So I think that's a loaded question, but I mean, the short answer is resources. There's a lot of, you know, funding platforms out there, and I think I should make a plug for the COVID-19 Survival Fund. We have a grassroots survival fund, and we are trying to raise money to support folks who can't access government support right now, and that includes a lot of our undocumented communities, our families with loved ones who are incarcerated, elders, folks with disabilities. And we've been starting to distribute funding, and we've been supporting some of the families that have been part of the hunger strike at Resistencia, at Northwest Detention Center that Resistencia is working with. And we have also been giving out money to families with loved ones inside. So those are some communities that we're supporting, but we're supporting a lot more. And so I can put out our link on there, on the chat, but if folks can support in that way. And there'll be call outs to the community about, mutual aid for folks getting out after we come to, after we discuss more some of the reentry collective folks. So thank you.
Thank you, JM. Maru, would you like to respond to that question as well?
Yeah, I can add to that. I think we have seen now with COVID-19 that it is possible to respond, that it is possible to be there for each other regardless of the system, right? When the COVID-19 mutual aid was being put together, the idea was precisely that we can wait for the state because we know the state is not going to be there for us. And if you see examples throughout America Latina, that's how we work. We don't wait for the government or for any entity to, like back in the day, I remember we didn't even know what a nonprofit was. The nonprofit concept was new to me when I moved here in the 90s, because we're used to be there for each other. So I think that COVID-19 has shown the possibility of us to respond and to be there for each other. But also part of our fight is to remind everybody that it's not that we don't have resources, is that the government chooses the priorities for us. So the money is there, it's just for us to pressure that the money goes back to where it's supposed to be. So it is possible to continue working so the system ends up working for us, not us for them. And so what, for example, today, this guy called me, he's like, oh, they're letting me out. What do I do? So we mobilized and we got him a hotel, we got him a flight, we got him a ride, and hopefully tomorrow at 5 p.m. he'll be with his family. And so when we call for a mass liberation, we shouldn't be afraid of it. And we shouldn't be afraid of thinking, imagining something different. We shouldn't be afraid of saying, yes, this person probably killed somebody, but there's also people that are killing hundreds right now because they're not budging in allowing them to have a house, to have a place where to stay. They rather keep that place empty. So in regards to the detention center, we're asking that the county should be responsible and get ready motels and hotels for people that are being released from the detention center to quarantine if necessary. So there should be a responsibility in local officials, because again, our people in cages are in cities, are in jurisdictions that are local, and those localities need to respond to the responsibility that they have, because they also chose for that place to exist there. Anybody that is not fighting a cage is allowing for the cage to be open. You are as responsible as anybody else for that cage being open. And I think the most important thing here is also to create a cultural change. We've always said this. Doesn't matter that we have the best policy in the books. A piece of paper doesn't mean anything to us, because we have that. We have had a really good bills coming in, and then once in a while we have really good decisions from judges. So what? People are still detained. ICE still deports people illegally. If anybody commits illegalities is them. And so this is not about a piece of paper or a law. This is about cultural change. It's time for us to begin thinking and acting in a way that creates the path to undoing the carceral system, and that we move from the idea that prisons and detention centers are the answer to, we need to make sure that everybody has what they need to be human beings, not to survive, but to actually to be happy, because that's our right to happiness. And it's our right to decide, do we want to be here or do we want to go back? Do I want to stay in this place? or not. And so I think cultural change is the most important part in our push to empty those places and get all of our people out.
Well, thank you so much. That's all the questions that I have, and thank you, everyone who's on the panel. Thank you for answering our questions.
Thank you, Tanika. We're going to move over to take action. And our next person up to lead us for take action is Johnny.
Cool. Thank you, Tammy. Hello, everyone. I just wanted to say thank you, everyone who's on this call, and thank you for taking the time to be here for this super important call. And a special thank you to our brilliant speakers who shared their wisdom, and also much gratitude for the work you are doing, the work that you've done, and the work that you continue to do. Especially in a pandemic, it's so inspiring, and I hope that it brings, I hope everyone is feeling driven to do more, to support more, and to love more, because that's the kind of things that we need. I was thinking about catastrophes, natural catastrophes, hurricanes, tornadoes, prisons, and I was thinking about how for the people who are the most vulnerable, where the conditions are already very, very tough, catastrophes intensify the situations even more. And prisons especially are no different. You heard today about from our speakers just how terrible the conditions are. The conditions have always been terrible, but they've just intensified. And you'll have the same people who are inside who are making sanitizers and who are making equipment to help doctors and stuff are the same people who aren't actually benefiting for the equipment, and the same people who don't get paid anything. They get maybe $1 a month, and it's just not right. I really want to highlight the what Will was talking about bringing humanity into this space. We're in a pandemic now, and humanity isn't something that we can just cherry pick. It's not about who should we care about, because we should be caring about everyone. And especially to Will's point about if we aren't taking coronavirus seriously, if we're not doing everything we can to stop prisons, the virus is only going to spread, because you have the office guards who have to go home, and they contract it, and then they bring it over there, and then it spreads. And so if we're actually trying to get rid of this virus, we really do have to free them all, and we know that the conditions where folks are, jam-packed, and, isolation is not the solution to protect our people. Actually freeing them does. And so essentially, by releasing the people, by freeing them all, by letting them go, we are actually fighting against the virus from spreading. So we're going to get into the action. And if you were with me last week, it's going to be a thunderclap. Paper and markers. We're going to spend 5 or 10 minutes. And so we're going to write the hashtags that you see under the slide. Free them all Washington, or free them all WA, let them go, free them all. And so essentially what we're going to do is we're going to write that on a sign, and then we're going to post this to our social medias, whether it's your Facebook, your Instagram, your Twitter, wherever you can. That would be awesome. And also just think about why we should be freeing them all. Today you heard from our speakers. You might have your own reasons why we should free them all, but think about why it's important to free our people. Something I've been thinking about is that Sister Assata Shakur, that famous line of that we must love and support each other. That means everyone. It's not, we must love and support some people. So I've been thinking about how by doing stuff like prison abolition, by freeing our people, we are following in the footsteps of our revolutionaries. And so, yeah, so feel free. I forgot to mention that we're gonna take a selfie with our signs. And so make sure that you post it to Governor Inslee, Jay Inslee, you tag Got Green Seattle, you tag La Resistencia, and COVID-19. So if you want to take 10 minutes, and then I'll come back, we're going to do a screenshot together. That would be great. Cool, cool, cool.
Okay, let's see. Anyone else want to join us? You can turn on your camera. Let me see if I can move cameras around. No, I can't move that one. Cool. Okay. 1, 2.
Lift yours, Tammy. There you go.
Oh, busy moving people around. I need to raise mine up, huh? Okay, 1, 2. Hold on, I want to move one more person out. I guess I can't move that one out. Okay, 1, 2, 3. Okay. I gotta move one screen out on. There's two screens. Oh, there's three screen of us. How proud, how nice. Thank you.
Mhm.
So, thank you very much, everyone, for joining and taking action with Got Green. Um, so, as you know, this is only our third one. So, we still have one more to go. And our next one, if you haven't seen it, our next one is post pandemic and moving to a just transition. And that one will still be at the same time, same day on Wednesday at 6 o'clock with the same link. So please join us. And that one is interesting. We will be having, oh, my piano is poked out of my head. Sorry. Oh, now we have Nikita, Matt, and Eggert. Sorry, that just happened. Yes, and we will be having a discussion on post-pandemic, and we will be also taking action at that one. So please join us then. And for this one, please take a selfie and make your post on your social media, and we will also share your posts. So thank you. Are you leaving us?